And welcome back to Insemination, the podcast that is all things donor conceived. My name is Laura High, your chaotic sperm donor baby of the podcast world. Today we have a very special episode with the infamous Dr. Amy, also known as the Egg Whisperer. By that, I believe you probably know what this episode is going to be about. It is going to be all things uterus and eggs, fallopian tubes. It is going to be fantastic. And before we get started, let's just do a little bit of housekeeping. If you have not liked, reviewed, or followed this podcast, please do, because all of that bullshit really does help us out. Also, please follow me on social media, at Laura High 5 on Instagram, at Laura High 5 on TikTok, Laura High on Facebook, but how many of us still have Facebook? But still, do it if you have it. That would be nice of you. Thank you. Also, follow me at Laura High 5 on Threads. Don't bother with Twitter. I refuse to call it X. Don't bother with it. That's fine. Leave it there to die. Just go follow me on Threads. And also Laura High on YouTube, because remember, this podcast is not just recorded, it is also filmed. So if you are a visual learner like myself, you can watch it on YouTube. I usually watch my YouTubes while I'm doing my hair or I'm doing my makeup, so you can just set it, get your stuff done, maybe while you're doing the dishes, and you can watch my goofy face make some insane expressions while listening to these incredible guests. And without wasting any more time, hold on, one more thing. Also, check out my website, www.laurahigh5.com. The 5 is spelled out, to see my show schedule for stand-up comedy, because I am a stand-up comic. So please come see me live. We'll have a great time. We'll have a party. Now, without wasting any more time, please welcome to the podcast, Dr. Amy. All right. Well, welcome to the podcast, Dr. Amy. How are you doing?
I am doing great because I get to talk to you, and I've been looking forward to this for a really long time.
Me too. I have been looking forward to this for so long. I have heard nothing but fabulous things from you from all different professionals, and they're like, Laura, you have to talk to Dr. Amy. So I have been so excited about this. Would you mind sharing with the class and kind of flexing a little bit about who you are, what you do as a profession, just so that we can understand where this amazing information is going to come from?
It's easy. I'm just an extremely passionate fertility doctor. I was born this way. I can't change it about myself, and I'm trying to change the world in terms of how we take care of fertility patients, just like what you are doing. So we're very like-minded in how we think. And I have a platform. It's not very large. And so I just continue to do what I can to teach as many people that are willing to listen. In an elevator, at line at the grocery store, I'm preaching about how to get your fertility checked.
Oh God, we would get along so well because man, because literally if I'm at a dinner party and one of my friends goes hey guys, ask Laura about donor conception. I'm like, oh no. This is well, everybody, you asked for it. Here we go. And then and then I go into my TED talk and I'm like, you fucking did this. Now we're going to learn all about it. But
Yeah.
what made you so passionate about it? What inspired that?
I think it's in my DNA. It's in my genes. So it came from my grandfather. My grandfather has delivered couples that got married, had babies that my dad then delivered that I have taken care of. So it's,
Oh my gosh.
yeah. So it's multi-generational from my grandfather to my dad. I'm sitting in the same office that my dad practiced in for almost 40 years. So when I say I was born this way, literally it's genetic. I could not imagine doing anything else. So that's why. And then as far as fertility, because my dad was an OBGYN, he retired in 2020, doing great. The reason for fertility is just everyone has that personal story. For me, it was a story in my family. My mother suffered through countless miscarriages. It was extremely heartbreaking for me, really hard to see as a young girl. And it left this impression on me, and I wanted to fix her and fix that. And so that's where I put my attention. And fertility doctors are recurrent miscarriage specialists. So I did a lot of research in my summer years, summertime in my college years, researching miscarriage, and that's made me who I am today.
That is so important because I feel like going through miscarriages is just this trauma that gets so swept under the rug, and it's just expected for people to deal with that in private, and that causes the horror stories that I've heard from so many people who have suffered from miscarriages and their treatment from either their family, their friends, or even their doctors.
Mm-hmm.
What do
Yeah.
you, when you have, because I'm sure that I'm sure that you and I are going to echo the same sentiments, that a lot of the problems that we're seeing from the fertility industry is the lack of care, respect, and dignity given to people suffering from infertility trauma.
And it's everywhere. It's not just with fertility doctors, it's with OBGYNs. Look, as soon as a woman's pregnant, do you know what we should be doing? It should be come in and see me. Let's check your levels. Let's make sure your blood pressure is good. Let's talk about what medications you're on.
Yeah.
But what we're seeing today is I can't see you. Maybe I'll have a spot for you when you're 12, 13 weeks pregnant. That's not how it should be with what we're hearing today about the increase in maternal mortality.
Mm.
It should be the opposite. We should giving even more care to pregnant people. And
Yeah.
then for fertility doctors, again, it's one of those things where everyone's busy, but I use the word, my schedule is never too full for you. I might be
Love
busy and I
that.
love what I do, but this is what I'm here for, is if you're pregnant, suffering, anxious, like I want to bring you in, I want to give you the TLC. And the one thing I've been doing more recently is talking to women about a prevent recurrent miscarriage panel. Because what
Mm.
happens is they'll go to their doctor and the doctor will say, well, you have to have 3 of these in order for me to do a workup. I'm like, that's mean. Like, you
That's
wouldn't, can you imagine saying that to a man? Like, you need to
what?
suffer and bleed. And, oh, yeah. Yeah. They'll be like, no, we usually don't do this testing unless you've had 3 of these miscarriages. And I'm like, no, I'm good. Like, let's just talk about doing it now that you've had 1. Let's just make sure there isn't, because it is part of human biology. Miscarriages happen. They're very common, but there
Sure,
sometimes
but
there is a workup. And if you know a little bit about some of the things I do, I create websites and use words to kind of help people along their journey. And one of them is the angel method. So the angel method are basically the simple steps that you can take if you've had a miscarriage, just to see if there's anything that you should do differently or think about in terms of like what you do next with your next pregnancy.
oh my gosh, the fact that you have to suffer from 3 miscarriages, like,
Yeah.
1 miscarriage is traumatic
Mhm.
enough, but you have to suffer from 3 for, like, a doctor to be like, "Okay, now let's start taking it seriously?"
Yeah.
Oh my goodness.
Animals get better care at a vet clinic than women do in this country.
Is this okay, is this because of how is this because of insurance reasons?
I don't think so. I think it's just the lack of empathy that we're seeing. And I
Okay.
think a lot of it when we were in COVID, it was excusable to treat people badly. We used COVID as the excuse.
Yeah.
And now that COVID's over, people are just used to treating people that way. And that's incredibly cruel. And we
Yeah.
need to train people how to have empathy. So I grew up thinking that everyone had empathy. By being a human being, you had empathy. Like
Right.
I just thought that.
Yeah.
It didn't until I was almost 40. I was like, oh my God, like a lot of people don't have that. And a lot of those people are actually doctors.
Yeah.
Like, and then some of them are my who I would consider colleagues. And I hear the things that patients share with me that they're saying to them around things like miscarriage, and they're just so cruel. So I try and just surround patients with love as much as I can. Even if they're not my patient, I hope that the messages that people get from, the articles that I share and
Yeah.
the interviews that I give, people just know that they're not alone and they shouldn't suffer in silence. There's so many resources out there. If you're not getting what you need from the doctor that you have, find someone that cares. And there are so many of us that care.
So I know that, like, obviously when somebody is going in for fertility care, they are in a state of either they could be suffering from infertility trauma, they might be like, this is my only way to make a baby. So there is a desperation. And that kind of and I can understand why that sort of makes you put up some blinders to red flags. And I totally get that and I understand. But what are some red flags that you would suggest to patients be like, you really like, please do not ignore this red flag. If you see this, please go find another professional.
Number one, I guarantee I'll get you pregnant by the end of, and they give you a date.
Yeah, that's a reasonable red flag.
Red flag. If
Red
you're
flag.
a
Okay.
if you're a 43-year-old and someone has promised you that they're going to get you pregnant by the end of the summer, I promise you that that's one thing I can guarantee, that that person cannot give you that promise.
Okay.
Number two is that, oh, you don't need to do any fertility testing. IVF will fix everything. Red flag.
Yeah.
Okay. Number three, oh, sperm doesn't matter. We don't need to worry about that. Red flag.
Yeah.
Those are the kinds of attitudes that we still see. Things are shifting a little bit, which is great for me to see, because I've been screaming, hey, everyone, an embryo equals an egg and a sperm. And then like urologists will be like, high-fiving the guys. Hey, dude, I had no sperm too, and I have 4 kids. I'm like, that's not helping me,
Oh my God.
Yeah.
What's it?
Yeah. Next red flag is if someone tells you no matter how much money in the world you have, you can never get pregnant with your own egg. Red flag. And this is a statement that I've heard doctors tell women who are still ovulating, have detectable AMH levels, and are under the age of 45. I've seen this statement shared with women who are 32, 33. Their AMH might be low, but their doctor is telling them that there's absolutely no way that they can get pregnant. So basically, if your doctor is coming across like a medical deity and not a doctor, red flag.
What a fertility doctor having a God complex. I've never heard of that.
Oh, and another one is your doctor doesn't know who you are. So, funny story, not so funny if you're the patient. A husband asked the doctor, so what do you think about, Jane's case? And the doctor says, who's Jane? Jane was right there
Oh
sitting in
my
the
God.
chair. Oh, yeah. So it's like, this is why I try and, uh, teach patients how to empower yourself, how to make sure that your priorities are your doctor's priorities. And there are ways of doing that. You bring your binder in, you remind the doctor your story, you send them an email ahead of time, because kind of summarizing your case. That's where we're at today. Like, that's what we have to do. And it's okay. Patients assume that their doctor somehow knows everything about them for the last 20 years. Like, somehow we have this medical record. Somehow we have this medical record aggregation site
Mhm.
that, sources all your records since you were born, and I can somehow see them, right? We don't have that. So you have to own your records, know your story, keep things organized, and keep track of things.
Yeah. Why is it? So I'm so glad you brought up IVF and saying we're just gonna skip to IVF, because this is what I hear from so many patients. And I also hear from other OBGYNs that are like they're so tired. Why is it that so many doctors just go immediately skip to IVF? And what is the problem with that?
Number one, there is this financial incentive. So when a clinic has an overhead, there are a certain number of cycles that they need to do to basically, you know, be financially successful. Okay, so there's that pressure within a clinic.
Okay.
So that's number one. Um, Number two, I mean, IVF, it's a wonderful treatment. It gives us the highest chance of pregnancy for a patient.
Hmm.
But if a patient's not there yet, they should never be forced to do it, especially with no workup before looking
Yeah.
at both the egg provider and the sperm provider. So I think it's also just less conversation. You get the patient in and out faster, but sometimes cycles don't work because you did that, because you didn't take the time to work up the diagnosis and figure out exactly what the problems are, at least what
Yeah.
the potential problems could be for that patient. And you miss things like a uterine septum or silent endometriosis or a sperm issue that needed a special technique before fertilize the eggs.
And IVF costs so much money. I mean, to the patient. So that's like you're just throwing their money away.
I mean, anytime you tell me that I'm going to spend over $1,000 for something, like the way I think about it is like, that's that many hours that I have to work more. Like, that's a lot of time,
Yeah.
And so, you know, you want to make sure that when you do something, and this is what I tell patients before we do IVF, I want to make sure that I've given you the best chance of getting pregnant at home.
Hmm.
Okay. In terms of like all the things that you need to know, so that if we were to, let's say, do this at home, of course, if applicable in your situation, you can do that. So that when we're ready for IVF, we're not looking back and saying it didn't work. I wonder what else I could have done differently in terms of lifestyle things. And then the other thing I tell patients, I'm planning on this cycle, so it's our only cycle, right? So when I do it, again, same thing. I don't want to look back and say, I wish I had known this first. Of course, you learn things along the way. And
Yeah.
some people need more cycles depending on why they're doing IVF. If it's for a genetic disease, they need to do more cycles, or, their age, certainly. But I plan a cycle and I always say, can I go to sleep at night saying that I gave this patient the very best chance with this cycle? If the answer is yes, it's thumbs up, it's go time. If it's no, I'm going to give the patient the option. And some patients are like, no, I'm ready, Amy. Whatever we get, I'm going to be happy. Let's start. And at least she has the choice up front rather than being told at the end, oh, I knew the cycle wasn't going to be good from the beginning. And patients are being told that. And they're not involved in the process. And that's where my sparkle method comes in. So those are the questions that patients should ask during their IVF cycle with each visit. The size of the follicles, the protocol, is the doctor happy? Are you happy? The retrieval date, do we keep going? What's the lining look like? And what's your estrogen level? So like, this is information that everyone should get along the way. So you feel, of course, you're not ever in control because we kind of have to let it go because it's not in our control as far as
Yeah.
what happens, but at least you can control the experience in terms of the information that you're getting. So you feel like you're understanding things along the way. Because by the time I see patients, they say things to me like, I had no idea why we did IVF. I don't know how many eggs I got in each cycle, how many are mature, what my embryos look like. And I'm trying to change that. I want
Yeah.
people to know this stuff. And the thing is, sometimes people realize that they wish they had known this stuff from the very beginning and they just were trusting of the doctor and the doctor was just looking out for them. And of course, they were. I mean, if it had worked the first time, that would have been wonderful. But, if you look at all the IVF cycles in the country, maybe 35% are successful. 35. That's less than 50% of IVF cycles that are actually successful.
Oh my God. That's That's so scary. And because I agree with you. It's like IVF, like I'm so grateful that this technology exists and it's wonderful and it's amazing, but it's like we need to it needs to be delivered in a educated sense
Yeah.
with information. What are because I know that people like jump to IVF. What are some causes of infertility that are often ignored?
So often ignored is a sperm issue. They'll say things like, so I'll have a patient that says, I don't know why I'm not getting pregnant. I'm like, well, how's the sperm? Well, they say it's a little bit slow and the count's a little bit low, but it's fine. So I call that sperm sugarcoating. So that's one reason that's ignored.
Okay.
The other thing is, I think when a woman is over a certain age, we're ignored. So when a woman, for example, is over the age of 39, a lot of people don't believe in us and they think that
Mm,
there's no, like, we're too old. So then we're not taken seriously.
yeah.
And sometimes our time is wasted with treatments for a long period of time, like IUI. And then by the time we're 42, we realize that IVF should have been what we did in the beginning. And sometimes it can be too late. So that's something else that is ignored. Silent endometriosis, often ignored. So endometriosis, very serious condition, can rob a young woman of her fertility. A lot of times it takes years for a woman to finally get that diagnosis. Another diagnosis that's often ignored is adenomyosis, similar to endometriosis in that it's a form of inflammation, but this is inflammation in the walls of the uterus and it can affect implantation. So that's another thing that's ignored.
What would be side effects, warnings of silent endometriosis and I apologize,
Ad-
adenomyosis?
adenomyosis.
Adam,
Yeah.
yes. What would be
Yeah.
those? Yeah. How would
So
you? What would be warnings for those?
painful periods, periods that are getting worse over time, unexplained bloating, bleeding with bowel movements, heavy periods, periods that are lasting longer with large clots, painful sex. So those are some of the telltale symptoms of both. And you can have one, you can have the other, or you can have both together.
How would you find out that you have either one of those? Is that a pelvic exam? Is that a sonogram? Like, how would you find out?
Both. So with a careful pelvic exam done by an endometriosis expert, they can sometimes feel it. Then a pelvic ultrasound, you can sometimes see it by how the uterus is shaped, how it's tilted, where the ovaries are, if they're stuck and immobile, so just attached to the side, sometimes in the back of the uterus. Adenomyosis, the uterus is enlarged, and you can actually see irregularity in the texture of the walls of the uterus. You
Oh,
can also get a pelvic MRI. There's also a test called receptiva. It's a biopsy that you can do on the lining of the uterus. It's done about a week after ovulation. And then the other way is laparoscopy. So camera goes in through the belly button, they distend the tummy and they can look around and not only diagnose it, but also treat it.
Oh, wow. I think actually, my mom, had that exam a long
Okay, the
time I
yeah,
yeah, she
laparoscopy.
said it
Yeah.
was the most painful thing ever. She said it
Well,
was awful.
yeah, she might be talking about the HSG, the tube test, but the laparoscopy recovery can be pretty rough because it's like being on a plane ride for 3 days straight in terms of how much gas pain you can have.
Yeah, she said it was descended, she said she was, like, filled with air. She said it was
Yeah,
awful. She said she was,
yeah,
like, out of because my poor mother went through 3 years of fertility treatment, because
yeah.
my father's sperm, they knew was, like, not it was not and they at least didn't have the technology at that point for my dad. I have no idea if his issues would be fixed now. Essentially, my father was I'm making like, sperm has, a certain amount of stages of fertility it has to go through before it actually becomes fertile, and it's like my father's sperm went through, like, 4 stages, and that was it.
Got it. So a maturation defect.
Yeah. I
Yeah.
don't know if that's something that is fixed now, but at least
Mm-mm. No.
okay. So,
Yeah.
yeah, that was his and then my mom, um, had a bunch of other issues as well, but her issues could get fixed. She went through 2 surgeries, one was a full reconstruction, and then 3 years of hormone therapy.
Do you need help finding your biological parents? Whether you're donor conceived, adopted, or an NPE, please contact DNA Angels. DNA Angels is a nonprofit team of genetic genealogists that help you identify your biological parents. And this group is run by donor conceived people, adoptees, and NPEs, so they will emotionally have your back during this process. DNA Angels has identified almost 5,000 biological parents since 2019 using test results from Ancestry DNA. And they are a nonprofit because they believe that your financial situation should not stop you from identifying your family. If you are searching to identify and possibly connect with your biological donor or missing parent, please reach out to dnangels.org. Must be at least 14 to apply, have tested at Ancestry, and presumed parents born in the United States of America.
Right.
So, yeah, so she's I think that's a big reason for me why I have so much, like, I hear what she went through, and it's like,
Well,
uh
she has grit just like you. Here you are.
I have to in full transparency, I may have only a third of the grit that woman has. I am I would never go toe to toe on my mother's grit. Like, that woman is a freaking brick wall of a human. She's incredible. Uh, like, hands down.
I
But,
love it.
so that I'd love to talk to you then about egg donation.
Mhm.
Is that something, that you do? Do you handle egg donors at all?
I do. I'm very passionate about how we care for egg donors and how we're how transparent we should be with them as well as intended parents.
How are you in terms of how are you seeing the industry treat egg donors, and what are your issues with that? Because you said, like, we need to be transparent. What are the lack of transparent issues that you are seeing?
So if it were up to me and I ruled the world,
Mhm.
I would want every egg donor to get eggs frozen for herself from the beginning.
That's legit. I love that.
Yeah. So when you donate a kidney, you have another kidney. The other kidney is not going to run out. When you donate eggs, 100% of the time, your eggs are going to run out. And sometimes these women are making these decisions based on financial needs.
Mhm.
So, they see the ads for the Louis Vuitton purse and they're like, I want that. And I'm going to donate my eggs to get that. And that's hard for me to see because it shouldn't
Yep.
be about that.
Yep.
And then when they're 40, they're like, oh, I need an egg donor now. And are any of my eggs out there left? So I'm trying to fix that. And
Yeah.
I feel like I've been talking about it more and more. I've been talking about it for a really long time. And I feel like finally things are changing and shifting a little bit where some of these egg banks are offering egg donors, egg freezes for themselves.
Yes.
There are people, creating their own version of freeze and shares. That's a program that I have. So where someone will consider egg donation in exchange for having their eggs frozen for themselves, and it's 100% open and a very high touch program that I run in my practice. And I want all egg donations, if it were up to me, to be open so
Mhm.
everyone meets ahead of time, so
Yes.
there's no so the egg donor's not wondering who's going to knock on her door in 18 years, and the families not wondering who their egg donor is. And
Yeah.
the donor conceived person feels whole and that they have all their information from the very beginning. So
Oh my goodness. Look how,
that's
what?
yeah.
Transparency.
Yeah.
Crazy pants.
Yeah.
Oh, everybody gets informed consent and the information that they need. Who would have thought that would be the way to go?
and my parents hear my spiel, like my
Mhm.
attendant, my patients, and the patients who did not choose that path for themselves, they've actually come to me years later and they're like, I think I harmed my child. I have no way of finding this egg donor. If they want to know their genetic information, I can't give it to them. All I have is this carrier screen and this family tree. I can't tell them more than this. And I think that I made a mistake. And I said, no, you did the best. It was based on the information you had at the time. And
Yeah.
don't worry about it.
100%.
Maybe we'll find this egg donor. There are ways, like, don't worry about it. But now that there are amazing women like you talking about this and being the voice, people are seeing these interviews, and I feel like it's changing their heart and minds. So
Yeah.
my patients who even go through high-end agencies, guess what we do? We meet the donor.
I love
And
it.
the donors love it. Like
Yes.
these women, they're like, oh my God, this is the first egg donation where someone wanted to meet me and talk to me. Like I was hoping this would happen. And I'm like, yes. So, and then they talk to their friends that are donors, and it's like slowly spreading as a thing. And I have never had an egg donor say no, that they did not want to meet the family of mine that they're donating to. Not
Yeah.
once have they said no.
Absolutely. I mean, and that's who we want as donors in general. We want donors who are excited about, and also recipient parents, but we want the donors who are excited to be like, yes, of course I want to meet the parents and see like where my genetics are going. And of course I want to make that connection. And it's like that's who we want. That's the behavior we want to encourage. Because not only is that good practically in terms of medical information down the line, but it also just gives it lifts up that veil. It allows transparency. We all can feel good. It's not just putting this out into the universe and then years later going, oh shit, oh shit, what did I do?
Yeah.
It makes it so much better. And I'm like, the only reason the anonymity exists is to protect the fertility industry. That's the only reason it's ever existed. It's never existed for the recipient parents or the donor's protection,
And
ever.
the other thing that I'll say is I like people. I like talking to them. I like
Yeah.
learning about their lives. And I'm nosy, and nosy in a way that
Doctors should be nosy. You should be
I'm
nosy. That's your
super
job.
nosy, like so nosy. And so like my nosiness takes time. It
Mhm.
means talking to people, talking to the donor.
Yeah.
I do my video calls with donors if they're not in town. They come in and they see me.
Yeah.
So I help, through agencies, through my program, make these matches, but centers aren't necessarily set up that way.
Yeah.
Right. And so the anonymity, it's not, I think it's just the easy way.
It's
It's just the
significantly easy.
easy way out.
So
There
easy.
are their agent there are clinics. I know of one right now, not gonna say any names. They will only do anonymous egg donations. They will not, if you have a friend or you're going through a freeze and share type program, they will not allow you. And I know the reason why. They just don't have the bandwidth, or they actually don't care enough
Yeah.
to change their protocols so that they can support people with those types of journeys.
We're seeing the same issue with sperm donation. I mean, there's a ton of clinics who are just like, absolutely the fuck not. And it's very frustrating because even if like the parents are like, but we've done all of the work, we have the lawyers, we have the contracts, we've done the psych evaluations, we've done everything. And it should be like families should be able to build the way that they want to. And the fact that, all of these parents are actively putting in this much financial and emotional labor into doing what is ethically right. They're listening to the donor conceived community. They're listening to older recipient parents, older donors, and going like, we've done the research. This is absolutely what we want to do. And the fact that they're being blocked is so frustrating.
Yeah.
But I'd love to talk to you also about care of egg donors. Because I get so frustrated when I see those Louis Vuitton ads as well, where they're like, sell your eggs, buy a Louis Vuitton bag. Ha ha ha. And they make it sound like egg retrieval and egg donation is like a haircut. That's what they
Right.
make it sound like. And it drives me bonkers because it is an invasive procedure. And I would love for you to just walk us through what is the process of egg retrieval, just front to back, what does it look like?
Yeah. So lots of exams, lots of injections, office visits, blood draws. And at the end, it's a procedure done while you're under anesthesia. It's a procedure that involves a needle that goes through the vaginal wall and we drain fluid out of the ovaries. And to get fluid in your ovaries, what does that mean? Your ovaries are going to get very full of fluid. So you're going to get bloated. You're going to feel like garbage. So when I talk to an egg donor about egg donation, and this is her first time, I almost try and scare her out of it. Do you know that you're going to feel like crap? You're going to feel bloated. You
Yeah.
can feel so bloated that you're not going to be able to walk for a week. You're just going to be waddling around. You can gain 5 to 10 pounds even in water weight. That will go away.
Yeah.
You're going to be taking a shot every single day. Are you okay with this? And then I asked, is your mother okay with this? Is your father okay with this? Is your family okay with this? Because I have patients that are like, my mom's going to kill me. She's absolutely going to kill me if she finds out. And I'm like, well, we need to talk about that. Like,
Yeah.
that's not the place, because that's a lot of stress, like that dynamic between a mom and a daughter. And I've actually had patient donors actually drop out at the last minute because she was so scared that her mom was going to find out. And so
Yes.
that's, I've seen so many things. So that's why I bring that up. But I think when
Yeah.
you are an egg donor, you're not just making a decision for yourself, you're also making a decision for your entire family tree.
And that's something
And
that no one wants to talk about, the fact that you are making a decision for your entire family.
yeah,
Especially, I mean, I do think that definitely affects sperm donors. I think, like, I would say, because their sibling pods can be significantly larger. So it's like, if you have, like, if you're a sperm donor, and your siblings have children, it's like, those kids have God knows how many cousins out there. Like, you have actively made a
totally.
choice, and a lot of the donors, whether they're egg or sperm donors, never tell their family. And it's like,
Yeah.
that's not good for anybody involved. And
Yeah.
what's going to happen when your family member decides to do 23andMe or Ancestry for fun, which I've done to my donor's cousin, and I'm like, "Hi." And she was like, "How are we related?" I'm like, "Well, funny story." And she was just like, "Oh, shit." She's like, "Well, I haven't talked to that cousin in a very long time. This is interesting." And I'm like, "Yeah, there's gonna be more of us popping in, so just giving you
Yeah,
a heads up that, we're here."
totally.
And but she was very nice. She was also a physician, and she just was like, "Well, this is interesting. Okay." It was not on my bingo card for today. And I've gotten another guy going like, "How the hell are we related?" And I was like, "Sperm donor baby." And he was like, "Oh, so this explains why I have this many cousins. Got it. Okay." And it's like, "Gotta tell your family.
Yeah.
You're gonna find out."
Yes, absolutely. And donors should think about like what they're going to tell their future partners if they're
Yes.
partnered, their children.
Yeah.
And these are, that's why I work with an amazing team of, psychologists, attorneys that,
Amazing.
talk about these things and from the very, very beginning to again make sure that the donors have informed consent. And they always talk to them about their own infertility or fertility, how old they're going to be when they start having their babies, and should they want to freeze their eggs, and letting them know that I'll help them with that. And sometimes we build in fertilizing a certain number for the family and then a certain number for them.
Absolutely. And I think that those are questions. I mean, these are things that I really, it frustrates me because there are so many banks and clinics that just do not talk about this kind of stuff with the donors. And it's like, this is all part of the informed consent and education that has to come along with being a donors, because they just go, "Oh, they kind of like almost like coo the donors and go like, "No, don't worry about it. You're just going to get so much money. You're going to help out a family, and like, shh, don't ask questions." And it's like, they're going to figure this out at some point. What I would also love to kind of ask you about is OHSS.
Mhm.
Can you explain what OHSS is?
It's when you get incredibly sick after an egg donation, but there are different levels of it, I should say. So there's mild, there's moderate, severe. Mild and moderate, like you're staying home, you're uncomfortable, you're taking pain meds, stool softeners, hydrating, you're fine. The severe is that it's what happens, and some people say 1 to 2%. I'm thinking it's closer to 5% for egg donors and
Okay.
underreported. But it's basically where you get so bloated that your abdomen fills up with fluid and you look like you're, 7 months pregnant. You're in so much pain that sometimes pain meds can't even help. And
Mhm.
the fluid pushes up on your diaphragm. So sometimes it fills up in your lungs. You can get incredibly nauseous. So you can't even tolerate anything to eat or drink. And when it gets really bad, it can affect your organs. So it can affect your kidneys, your liver. you might stop urinating completely because your kidneys decide to shut down. Your liver enzymes might go up because your liver decides to, you know, act a little crazy because of the
Yeah.
OHSS. But for the most part, you know, we have really good treatments for it,
Mhm.
like bromocriptine, letrozole, aspiration of the fluid. We do it vaginally now. In the old days, we used to do it abdominally. We don't do that anymore. The use of Lupron as the trigger shot. So avoiding HCG as a trigger shot also really helps. Seeing the patient early and often, making sure that you're titrating the doses of medications appropriately. High dose of, I have patients follow a high protein diet and hydrate with electrolytes throughout the process. And I'm constantly annoying them about drinking and peeing and on repeat. So, but it's very serious. And I think what happens, so my donors, like I work with them, they see me, I do their retrieval, they get my cell phone number. You can imagine, like I'm very hands-on. Other clinics, they have no one to talk to. Like they'll call in, they'll get a call 2 days later and they'll be like, take a Pepsid. And they don't tell the donor to come back in and get seen. And I've seen
Yeah.
complications in cases like that, which are heartbreaking to me. And one big thing I always tell, if anyone listening out here is an egg donor, don't be an egg donor during holiday time. Don't do it over Christmas. Don't do it over 4th of July. Don't do it.
Ooh, that's a
Don't do it
good.
when everyone's on vacation because no one's going to call you back. If you have an
Oh, that's so
emergency,
smart.
yes.
So I talk to a lot of egg donors who have suffered from OHSS, and then the egg bank, wherever they're doing their retrieval, invites them back to do another retrieval after having OHSS. Is that a good idea?
So in the first cycle, you learn a lot about the donor and how she responds. So if someone has OHS the first time so badly that they were hospitalized, had to have fluid drained, that's one thing. But if she was uncomfortable, had pain, got through it, then the next cycle, they would learn from that and be like, oh, we'll reduce your dose of medications. We'll include bromocriptine letrozole, make sure that we didn't give you the trigger shot. So there are things a clinic can do to adjust things to make sure that the same thing doesn't happen again from the lessons you learned the first time. So if it hasn't happens the first time, if they make adjustments, there's a lower likelihood that it'll happen the second.
Mhm.
But OHSS does take an emotional and physical toll on someone.
Yeah.
You can get traumatized, you can get PTSD from the experience. So if a donor like bounces back and she's fine, she can donate it again if she really wants to. If you're hospitalized and super sick, then I would suggest that you find another way to give back to people who want to bring more love into this world. There are so many other ways of serving others.
So I know that like for ASRM guidelines, they recommend doing a maximum of 6 retrievals.
Right.
Do you think like 6 retrievals in your professional opinion, like that's a good safe number? Do you think it should be less than that?
I think approximately 6 is good. I mean, not all egg retrievals are going to result in a live birth. And I just take a look at the full picture. And I always ask egg donors, like, do you know what the outcome was of your first, second? If they don't know, I'll try and reach out and find out, see how
Mhm.
many children were born and what happened. And sometimes some of the donations are for the same family twice. Those are the kinds of things where I'm like, okay, well, it makes sense. I think now recipient parents are more wise about these things.
Yeah. They're getting
Finally,
smarter. Yeah,
they're getting smarter.
they
And
are.
so recipient parents are looking for donors that have donated less. And I have patients that'll actually compensate donors up front and say, well, this is what you would make for 6 donations. I'm going to pay it to you in the first so that you don't donate again. So I've had people make those arrangements with donors. And then these like freeze and share programs, most women go into these programs because they don't want to be serial donors. They just want to do it once for themselves. And so that's what makes that program pretty attractive.
Yeah, you don't hear of a lot of serial egg donors. Like that's just not.
Oh, I certainly have.
Oh,
Oh,
really?
oh, there's so many fertility fraud cases out there, Laura. Egg donor cases. I've seen egg donors change their name, go to clinics, say they've never donated before. So this actually happened. I don't want to identify who
No,
was
yeah, okay.
involved, but let's just tell a little story here
Please.
where I had an egg donor monitor at a clinic for me. And I live in San Francisco. This is another part of the country. And the egg donor goes back to that same monitoring clinic saying that she had never donated before, but with this, like that same clinic that she monitored with me. She with me, she was in her sixth egg donation. So she had probably, I don't know how many times the fact that she was doing that tells me that only God knows how many times she had donated.
Oh my gosh.
Yeah, and there are people that like they'll donate with one clinic and they'll tell them a certain number, and in between those donations, they'll go donate somewhere else, and there's no way of tracking them. There's
Yeah,
absolutely no way.
there's no
And
way.
you can have an egg donor that signs up with one egg bank, and you'll find her on actually multiple egg banks. And the reason why I know is because my patients are doing these searches. So I'm giving them all the egg bank lists. I'm giving them links to all the egg banks, and then they're like, and some of them are actually pretty clever. Like they will like have a tattoo in one picture, and then in another one they'll have covered up the tattoo, but it's the exact same donor. So they'll make themselves look a little bit different so people can't pick up on that. But you can't always trick me. So I try, like
No.
I have lots of things that I do, with a frozen egg bank, like you can't interview the donor. But with donors that are coming through like an agency, there are things that you can ask and ways you can ask them to kind of figure out if you're going to be a victim of, let's say, fertility fraud.
Look, I can't get sleep because of some of these serial sperm donors. I don't now I have to the freaking egg donors as well. God damn it.
I'm sorry,
No.
Laura. I'm
Oh,
sorry.
oh no. Okay. Oh, what? No. What are you doing? It's fine. It's not fine. Okay. Well, that's good to know. Um, that's terrifying, and that's gonna haunt me now. I mean, it's because we always kind of were like, it would be like we knew that it was possible, but to have a serial egg donor, we just knew was like so much harder because of just the nature of egg donation.
Right.
But oh, that's just really. What do you think the motivation is behind? Is it purely financial? Like, what do you think the motivation is?
100% financial.
Okay.
100%. And these are the donors that don't want to know who they're donating to. They don't want
Yeah.
to meet the families.
Oh yeah.
For
This
them,
is not
zero
someone.
connection.
Yeah.
This is just purely financial.
Yeah, this is not anyone who's doing it on that way is not thinking long term about is
Mhm.
this good for the recipient parents? Is this good for the future donor conceived child? Like no one is. Like that's you this is 100% selfish intentions. And also ugh, and I and it also just I mean like why they're doing that is just awful, but it's like I also do think about the long-term implications to their body that they have no idea what they're doing.
Absolutely. So when I talk to a donor, I always talk to them about their family history. Did their mom have endometriosis? Did she have fibroids? Letting them know that these are genetic issues and that going through egg donation can stimulate inflammation and increase your risk of having a fertility condition, because they can't be lied to. They have to be told the truth. Because I tell my patients who are going through IVF the same thing. When patients go through multiple rounds of IVF, that, while we're trying to help you get pregnant, sometimes these medications can cause things to grow that weren't there, or they were there, but so small that you didn't recognize them when you first did your initial cycle.
And what do you like? How do you handle that conversation? Because we know that there's a massive lack of research into the long term side effects of being an egg donor. How do you handle that conversation?
Well, I think there's not just, so egg donation and the cycles that you do are very similar to IVF. There's no difference. What we are lacking, because I hear this statement all the time, where there's no long-term data. I'm like, there actually is. What we're missing is data about women who do 5 or more IVF cycles. What is their story long
Yes.
term? And so I wish that that would be possible. All we do is we take a whole bunch of women who've gone through IVF, we watch we look at them over time, and we spit out these numbers like no risk of breast cancer, no risk of ovarian cancer. But what about those women who've done 6 or more cycles, 9 cycles, 12 cycles? I think we're going to find out that they have a higher risk of endometriosis, a higher risk of, other adenomyosis, and I'm not sure what else we will
Yeah.
learn. But now that IVF has been around for over 40 years, we're seeing this trend, especially because women over 40 are doing IVF now more than ever, where
Yeah.
women are doing 5, 6, 9, 10, 12, 21 cycles for one healthy egg.
Well, and I mean, I know that you and I were connected through the infamous Dr. Diane Tober, who I adore all
Me
of the work that
too.
she does, and what she inferred to me was because I asked her about like comparing IVF to egg retrieval, and what she said to me was it's not comparable, because she was like, the treatment of egg donors broadly in the United States is not similar to IVF. She was like, yes, it is technically the same procedure, but in terms of her data, just how they treat the egg donors, because the egg donors are essentially treated like merchandise versus IVF patients are treated like patients. Again, and I say this broadly within the United States. And that's what, at least for her, she said that does seem to affect the data a little bit.
Yeah, I mean, their estrogen levels are going to be higher just because of their age group. It's younger than the average IVF patient. So they might be at higher risk of some of these inflammatory disorders that can affect fertility for sure.
If you got, again, like ruler of the world, what would yes, taking your magic wand and you got to just change everything, what would be the regulations, that the standardization of care that would be implemented for egg donors? What
Oh,
would you go, I want to see this. This would be great.
well, I want this industry to be very similar to how we breed animals.
I know, right? Isn't it really
It
like the fact
should,
that we breed
we
animals
should,
is like way more regulated than this?
I mean, when you get a puppy, you get all the paperwork. You know exactly the parents, you know all the genetic history.
Yeah.
Everything is registered and you get
It's
that
so, so
AKC
we say that.
certification.
If
So
only it was like dog breeding, it'd be so much
yeah,
better.
yeah. So I had this idea of creating a site called The Honest Ram. And that it was for
Okay.
sperm donors, like how, because the sperm don't, I mean, with egg donors, at least you get adult pictures, right? Sperm donation, that's like, they need so much help.
I
So
find
much
it
more help.
so icky how they use baby photos for sperm donors. I find
Yeah,
that icky because you're looking at baby photos going like, I want that sperm. And I'm like, that's
right.
just creepy. I'm sorry. Like, I want that baby sperm. I'm like, no, what are we doing? I hate that tactic. It's so
Oh
creepy.
God, now I can't look at those baby pictures anymore.
No, oh God, like all the banks do it. And I'm like, guys, can we just, like, I hate
Yeah,
it so much.
yeah. I mean, I think for egg donors, I think it would be great for us to have a national database so
Yes.
that there cannot be any fertility fraud. Um, and not to tell you more scary stories, but I've had situations
Oh,
where,
I'm the queen of scary stories. Give
yeah,
me the
like
scary. Give
don't
it to me.
like a donor will come to me and have like the shittiest cycle. Like her cycle is so bad that she would need an egg donor herself. Like
Mhm.
that's how bad her eggs were. And then she continues to donate, acting like she's never donated before, causing more harm just so she can get the money, you know? And it's like
Oh,
that stuff should not happen. Like there's no
oh,
reason why other patients should be a victim to this. And other clinics and agencies, it's just not fair to everybody. But if we had some sort of like a, a system where you could track the egg donor, kind of like a medical record system where everything is just there and visible and
yeah,
you know how many cycles she's done and we can all see it.
yeah.
I would love that. And then look at outcomes over time. I would love if egg donors could be required, probably not every year, but like a 25-year-old usually has like a 50 to 60-year-old mom. She probably doesn't have that, you know, depending on how, you know, how she takes care of herself or family history. She may not have that many medical problems. So a 25-year-old's like, my mom's healthy, you know, my dad's healthy, but things happen over time to family members. So
Yeah.
have a system where egg donors are filling out a medical questionnaire just about their family every 2 to 3 years. Like that would be amazing. I think it would just
Listen,
make everyone so happy.
it would
Like,
literally save lives. It would save countless lives. Oh
yeah.
my gosh. It would, again, this is talking about preventative care.
Mhm.
It
Yeah.
and which is what we need. And it's just, oh, yeah, because I mean, like, that's what we're saying, is there needs to be significantly more push for an updated medical history, because that
Mhm.
snapshot when you do donate, yeah, everything's fine. Of course, everything was fine when I was 20 years old.
Right.
Everything
Totally.
was
My
fine.
fine. Totally.
100%. 10 years later, yeah, some shit popped up.
Yeah.
Yeah.
And then if your egg donor developed like a condition at 30 or 40, I think it would be nice for the 15-year-old or however old child and then donor conceived person later, if they find out, like that's important to them.
Yeah.
Like, because then they can make decisions about their own life based on what is in their genes. I would love if we could require openness, and there could be different levels of openness, like meeting from the beginning, or once
Mhm.
a child is one, or at least knowing if one of them wants a connection, like they
Yeah.
can reach out at any time, and just making sure that everyone's on the same page from the very beginning. So that takes a lot of counseling. Um, what I do, depending on what people want, is so we'll facilitate, individual sessions, and then my psychologist will facilitate a group session, and she can do that over video. If people don't want to meet, she can do that over phone, or she can just get to know everyone's desires and just make sure everyone's on the same page independently, and then put that into the
Yeah.
big psych summary. So no one looks back and says, I wish I could have done this or that or had known this. As far as number of cycle limits, I think 3 to 4 for
Mhm.
an egg donor feels very comfortable for me, because I always think about what I would want for my child. Like,
Yeah.
I don't and for some people, it's like a cool thing. Like, that's really cool that they'll just have all, these dibs or, DNA siblings out there. But it means different things to a lot of people, and not every child may be able to handle like that large of a sibling pool, a donor sibling pool. So like
Yeah, we'd
having
like
100,
to
yeah,
manageable numbers where
yeah,
it's we always think about, like, how many siblings can we actually is it genuinely possible to have meaningful relationships with?
right.
And, yeah, definitely when we start getting into that double digit territory, it starts getting a little overwhelming for
Yeah,
many of us.
yeah.
Um, but I know we are winding down to the end of our time, and I know that you are very, very busy. As you said, like, I'm never too full, so I wanna make sure that we
Thank you,
respect
Laura.
that bandwidth. But is there anything that I have not asked you that you're just like, "I really want this to just be put out there?"
But can I just add one more thing real quick, Laura, to
Oh
that
my
last
god, of
thing
course,
is
I'm so sorry!
I love connecting families that have used the same donor.
Yes.
So if
Oh, of
there's I
course.
always do that too, especially if they're through me. So if I've
Mhm.
used a donor and I loved her, and then I'll know, like, I'll meet another family that I think would be a good match, then I'll connect them.
Yeah.
And then sometimes we'll create like a Facebook group just
Mhm.
for the, children conceived from the egg donation and the egg donors in it. It's just really fun. And I've even had everyone over to my house before. So I had 3 families, the
Oh
egg
my
donor,
goodness.
yeah, even the sperm donor. I mean, those are the kinds of
I
things.
I I
That's
love the "it takes a village" mantra. Like,
Yeah,
that's the thing that, like, it takes a village,
yeah,
and it can be
totally.
done with such love. Love is not finite. Your child is not gonna get traumatized by too much love.
Right, right,
Like, I
right.
love that.
Yeah. So what I would put out there into the universe is take your time. These are very serious decisions.